Hello. Good Friday morning. It's Bruce Williams, and it's time for another Gross Path Challenge. As I do at the beginning of all of my lectures, I want to thank those people who have provided me images that have allowed me to put this test and so many others together over the course of my career. Well, let's get out our papers and pencils and get started. Image number 1 is from a Rhesus macaque. Please outline the pathogenesis of this lesion. Give yourself about 90 seconds for this one. These get a little bit long and writing intensive. Okay, time's up. When you're writing on a pathogenesis, it's good to have 4 or 5 different concepts, string them together with arrows, and generally the lesion that you see is going to be the last in the string. Okay, what I see in this particular case is I see tooth loss and gingival hemorrhage. So that's going to be at the end of my string of concepts. This particular lesion is associated with a disease known as scurvy in non-human primates. And the pathogenesis of that lesion starts with the fact that primates, along with another number of other species, including guinea pigs, some birds, fish, we have a lack of a particular enzyme called gulonolactone oxidase, which allows other animal species like dogs and cats and pigs to make vitamin C. So that's number 1, lack of gulonolactone oxidase. Okay, next step is that you have to have no vitamin C in your diet, whether you're getting none or the feed that you're feeding your animals is old or got very hot, and so the vitamin C is leached out. But even though we don't make vitamin C, if we're supplemented, you won't get the lesions. So that's step 2. Vitamin C is an essential cofactor of 2 enzymes, proline and lysyl hydroxylase, which are essential cofactors in the cross-linking of collagens type 1 and 4. Collagen type 1 is very important in connective tissues, bone, and joints. Collagen type 4 is an essential ingredient in the basement membrane of blood vessels. So that would be my 3rd step, deficient cross-linking of collagen type 1 and 4 due to decreased activity of proline and lysyl hydroxylase. And then my last one is gingival hemorrhage and loosening of the teeth. So, classic case of vitamin C deficiency or scurvy in a non-human primate. Okay, let's writing on this one. Slide number 2. This is a red fox, commonly seen in the part of North America that I live in on the East Coast. I'd like a morphologic diagnosis and a cause. Okay, time's up. This is a very commonly seen disease. I can see foxes when they run through my backyard with large areas of alopecia and crusting. This is a diffuse hyperkeratotic dermatitis, and the cause is the scourge of foxes in this area, Sarcoptes scabiei. The hyperkeratosis results from the burrowing and the inhabiting of the epidermis by the parasites, and they cause a very profound production of scale and thickening of the epidermis. There is a dermal inflammatory factor, but I don't think that that's the most important piece of information or piece of the morphologic diagnosis. So I call this a hyperkeratotic dermatitis. On to slide number 3, a great picture from Dr. Virginia Pierce. This is from a piglet. I would like a morphologic diagnosis and 2 possible causes. Okay, we're back. You can see that there's multifocal to coalescing incrustations on this valve. A lot of people would write down vegetative valvular endocarditis. I think that that's the disease name and not really the morphologic diagnosis, is what you would see under the microscope. So, or at least grossly. So I am going to call this what I usually do. This is multifocal coalescing fibrinous and suppurative valvulitis. If you've ever looked at this, it's a very boring lesion. The valves are covered by a thick layer of fibrin. There are some bacterial colonies scattered through it and a sprinkling of neutrophils. So fibrinosuppurative valvulitis, in my mind, is a much better morphologic diagnosis than vegetative valvular endocarditis. And when you're asked for a cause on this, it doesn't matter what the species is. I would always go staph, strep, and coliforms. You can't go wrong there. Okay? Staph's almost always Strep aureus, coliforms, pick one, E. coli, salmonella, whatever, Klebsiella, those will all be good. And then strep. Strep's an interesting, very interesting bacterium. Which is unusual for a gram-positive, but the pathogenic streps have a number of toxins which act very much like endotoxin. They cause endothelial damage and a tremendous outpouring of fibrin throughout the body, especially in the potential spaces like the pleura, the meninges, the abdomen, and the joints. But they're very happy to do it in the, elsewhere on the valves as well. And when I'm thinking about strep, I'm going to search my mind and think, is this species I'm looking at, is there a special one that they have? And pigs, of course, it would be strep suis, probably strep suis type 2. But a lot of animal species have their own strep that they're very famous for: strep bovis, strep canis, strep viridans in possums, and strep pneumoniae in primates. All the rest of them, I'll probably just put Streptococcus species. Okay, ready to move on. I hope you're pausing in between and trying to play this game at home, because it makes it a lot more fun. Slide number 4 is tissue from a horse. I would like a morphologic diagnosis and a cause. Okay. We are looking at a section of liver. A lot of odd things about this liver. Number one, when you cut the liver, it should be a nice reddish brown sort of brick color. And this one is not that color. It is sort of greenish, suggesting a retention of bilirubin. And then when you put that section of liver, this big thick section of liver, down on the glass to take a picture of it, there should be some fluid come out, and it should sag a little bit one way or the other. And this one is very hard. There's no fluid exudation. So there's extensive fibrosis going on here. And this is a classic look for cirrhosis in the horse, as opposed to the dog, which has large nodules of macronodular hepatocellular regeneration. Horses and cattle, ruminants, don't generally do that. They tend to have a lot more fibrosis, and they'll have contraction of the liver. And that's what's going on here. There is a granularity to the liver that you normally don't see, because all that fibrous connective tissue is sort of contracting down. And this liver is probably very small if you had the chance to look at the entire liver. This is classic for cirrhosis in a horse. My morphologic diagnosis is diffuse hepatic necrosis and loss with post-necrotic scarring. If you want to say fibrosis, that will be fine too. The cause? Well, Dr. Paul Stromberg tells me, and I believe him, that in Texas alone you have over 350 pyrrolizidine alkaloid-containing plants. And so pyrrolizidine alkaloid toxicity would be a great possibility for this. You could also see it with aflatoxin as well. Chances are you'd never figure out what this is. This is a condition that takes years to develop, and the animal's probably been grazing a number of these plants over the years. Progressively, the liver's getting more fibrotic and smaller until the animal goes into hepatic failure. Slide number 5 is a parasite. Gotta love the parasites. This is tissue from a chicken. Please name the agent. Well, this is a cestode of chickens, very commonly seen. Usually doesn't cause much of a problem. You'll cut in a section and you'll see cross section of this adult cestode. You can see outpouchings and fibrosis of the wall of the intestine in animals that are infected with this particular agent. Notice I said infected, not infested. If you're a pathologist, you're dealing with parasites, they are infections. If you are somebody who works for Orkin and you go out to people's houses and you kill termites and ants, that's an infestation. So, this is Ray latina. There are a number of species of Ray latina. It's a common cestode parasite of the intestine of chickens and probably other poultry. Ray latina echinobothrida, Ray latina tetragona, Ray latina cestacillus. These are all various species of Ray latina. Boy, we're moving quickly. This is a great lesion. This is an old Kodachrome that I studied on when I was a resident 30 years ago. This is a tissue from a lamb, and I would like a morphologic diagnosis and the cause. Okay, this is a great picture. We see bilateral areas of necrosis and hemorrhage within the thalamus or the corpus striatum of this particular lamb. Now, this is a great concept. When you see bilaterally symmetrical lesions, viruses won't do them, bacteria won't do them. This is either a toxic or a metabolic lesion. These are the ones that cause bilaterally symmetric lesions. They target certain areas on both sides of the body simultaneously because it's the same tissue, essentially. So my morphologic diagnosis is bilaterally symmetrical necrohemorrhagic encephalitis. It's a classic lesion associated with the cause of Clostridium perfringens type D, also known as overeating disease, pulpy kidney disease, blind staggers. And Clostridium perfringens type D affects any age animal, usually over a couple of days old, because it secretes an epsilon toxin along with the other toxins that it secretes. But this epsilon toxin is cleaved by trypsin in the intestine, so the very young animals don't get it. They don't have the trypsin in the intestine to activate the toxin, but when it does, it combines with the mucosal ulceration caused by the excessive carbohydrate load. It gets into the bloodstream, it circulates around the body, and it causes hemorrhage not only in the GI tract, but also classically in the brain and in the lung. These animals, it takes a couple days to get these lesions really going. The lesion itself is called focal symmetrical encephalomalacia. I prefer the term bilaterally symmetrical encephalomalacia, but nobody asked me. And after a couple of days, you'll see neurologic symptoms, and the animals will eventually succumb to the disease. So, some animals are going to die acutely. You're not going to see this lesion. Another classic lesion associated with this condition is precocious autolysis of the renal cortex, which is known as pulpy kidney disease. Okay. Slide number 7 is one of my favorite all-time pictures because it reminds me of going to the ice cream parlor. It's a great picture by Dr. Federico Giannini when he was at the California Health and Food Safety Lab. And this is tissue from a chicken. I would like for you to give me a morphologic diagnosis. Okay, time's up. This is a very, very fat chicken. Look at all the fat in the coelom. And the liver is extreme. This is an overconditioned chicken. The liver is fatty as well. These animals might also, I don't know, maybe insulin resistant or something like that, but this chicken is just getting too much. And this is not uncommon in backyard chickens, and people overcondition them, whether they think that they're going to be better to eat. You're not going to eat this fat. So you're not really doing much by overconditioning your chickens. But what you will do is you'll have a certain number of birds which will develop severe hepatic lipidosis, and a fatty liver is one that is prone to rupture. And so these particular birds will rupture their liver and they will bleed out. The condition is known as fatty liver hemorrhagic syndrome. And just a wonderful, wonderful illustration by Federico Giannini. Okay, this tissue from a goat. Be very careful with your morphologic diagnosis. Be very thorough and give me a predisposing condition. Okay, time's up. This is the rumen from a goat. We have multifocal areas of ulceration and necrosis within the rumen that are surrounded by an area of hemorrhage. This is very characteristic lesion. And the predisposing condition that I'm looking for is excessive carbohydrate ingestion. If you want to call it ruminal acidosis, that would be fine. And this is a lesion that comes days to weeks afterwards. It's not the first thing that you will see, but these circular areas of necrosis are the result of mycotic rumenitis. As a result of the precipitous decrease in pH and mucosal ulceration, a number of things will get into the wall of the rumen and will travel to other parts of the GI tract and to the liver when it gets into the portal circulation. But these areas here are the result of thrombosis of mucosal or submucosal vessels by the fungi that are survivors, that can survive the low pHs associated with ruminal acidosis. And it takes a couple of days, but they will get into the wall, they will get into those vessels, and they cause thrombosis and infarction of the overlying musculature. There may have been no area of necrosis here. They might have gotten into it in another area of the rumen. They circulate in the blood, they find a way to grab onto the wall, and they cause thrombosis, and everything that's supplied by that vessel will be infarcted. Your morphologic diagnosis, and this is not an uncommon lesion, we see it in a number of conditions, would be multifocal to coalescing ruminal vasculitis with mucosal necrosis. When I say that it's not an uncommon lesion, vasculitis is something that as pathologists we probably overlook a lot. When you look at a turkey with erysipelathrix, that's actually a cutaneous vasculitis with overlying infarction. So remember, vasculitis can result in infarction of the overlying skin, mucosal membrane, etc. A similar thing happens with the animals that are infected with malignant catarrhal fever virus. That's a vasculitis. It's a lymphoproliferative vasculitis. Affects the vessels, but you get large areas of gastric mucosal ulceration. Not because the virus targets the epithelium, but it targets the underlying vessels. Okay, once more, multifocal coalescing ruminal vasculitis with mucosal infarction. Only two more in this test. Great classic lesion. See in a lot of our old military working dogs. Old dogs very commonly get it. If you had an x-ray machine, you wouldn't have any trouble with the diagnosis. I'd like two morphologic diagnoses for this slide. Okay, hopefully the first is very obvious. The second one, if you know the pathogenesis of the lesion, you'll get that one as well. There is diffuse severe ventral vertebral spondylosis. There's excessive osteophyte production. Basically, all of these vertebrae are locked into place. This animal obviously is going to have trouble moving around. Severe backache, not a great athlete. And the most common cause of ventral vertebral spondylosis, especially in the lumbar spinal cord, is disc rupture. Now, when I say disc rupture, don't think of the one that's in all the books, where it ruptures up into the spinal cord, causing paresis, causing paralysis, or can rupture in chondrodystrophic breeds with such force that it causes obliteration of the venous sinuses, hemorrhage, infarction, and the animal just rapidly goes down and actually can be found dead. Let's not think about that one. Let's think about the one that's much more common, where the disc ruptures ventrally. It ruptures ventrally, and then the discs become unstable, and the body is going to respond by trying to stabilize them by putting down bone at the bottom. So, morphologic diagnosis, multifocal and intervertebral disc rupture with ventral extrusion of nucleus pulposus. Number 2 is ventral vertebral spondylosis. Our last slide for today is a hamster. It's an old hamster. I'd like 2 morphologic diagnoses. Okay, first morphologic diagnosis is anosarca. This animal is severely hypoproteinemic. And then the second, or the likely associated lesion, I should have phrased that better, my apologies. Likely associated lesion is going to be a common problem in older hamsters, and that's renal amyloidosis. All old rodents have terrible kidneys, but they don't generally get this level of anosarca. Usually this is associated with amyloid, severe protein wasting through the kidney, and hamsters are well known for the development later in life of amyloid in the kidney and the liver. Okay, that's it for this week. Hope you had a good time. I hope you come back frequently to the Foundation's Facebook and YouTube channels for more of these growth path challenges or lectures on a wide range of subjects. And we look forward to putting more materials out for your interest. I hope you have a great weekend.